Good afternoon. This is Kara with NCFlex, and we'll get started in just a minute. Okay, you should be able to see the slides on the screen. There's also a Q&A section that you can click on and type in questions as we go along. We are here today to talk about the NCFlex dental plan offered by MetLife. We also have other NCFlex team members on here today to help answer questions. And we also have a MetLife representative with us in case there's other questions we may not be able to answer. And if if you do have a question that we have to research a little more, we may ask to take it offline and email us directly so that we can look at your specific situation. I'm gonna put a link in the chat to the slides if you would like to view those as we go along, or you can save them for later. And these are posted on our website, on our webinars page. That's where we post all of the slides that we do for every monthly session, as well as recordings for each session. We do record these and then post them later so that you can watch them back if you need to. I'll start out by saying that NCFlex does have our dental is through MetLife. If you are an employee with Department of Adult Corrections or Department of Public Safety, you may also have a MetLife dental directly with your employer. So if you're not sure which MetLife dental you have, you can check with your HR department, or you can email us ncflex@nc.gov and we can check for you. The only time that it will matter is with the one through DAC or DPS. The benefits will be a little bit different the way they pay. They do have a different max. And also, when you're transferring from one employer to another, that one's not going to transfer with you. Ours would transfer from one NCFlex participating employer to another. So, but their benefits may be similar. They're just not exactly like ours. So today we're going to talk about why you may want to choose NCFlex Dental over other dental plans, an overview of our dental plan in case you may already be enrolled in it or considering enrolling in it. You may want to just know how it works, what our rates are currently, what does in-network savings mean, because you can go in-network versus out-of-network. You can go to any provider. There's just some savings if you choose in-network. How to find a dental provider. Oral health and well-being, I actually removed that for this year. That was from last year, and I didn't remove it from the agenda. Using your healthcare FSA for out-of-pocket expenses, and dental travel assistance when you go out of the country, and then the MetLife mobile app at the end. So with NCFlex benefits in general, our premiums for the benefits, the money you pay monthly or semi-monthly to have these benefits, comes out of your check before taxes due. So you're going to save approximately 25 to 40% in taxes on those premiums, and there'll be an example on another slide to show you what that kind of means. Our plans do transfer between state agencies, universities, participating community colleges, and participating charter schools. So if you go from one participating employer to another, then the NCFlex plans, for the most part, will go with you. We have a couple of plans that the universities don't use the same ones, but the dental, they do use our same dental. And if you want to know who participates in the NCFlex plans, I'm going to put a link in the chat, or you can see who our participants are. Because we say participating community colleges and charter schools, so some participate with our plans and some don't, and you can see on that link that I posted. There are negotiated fees that are typically less expensive than the average charges in the same area. So when you do have dental insurance and you're going to an in-network provider, the fees are going to be negotiated. So they're going to typically be lower than they would outside of having the dental insurance. You can choose from a large network of carefully selected participating dentists. With MetLife, there is a huge network across the state. I understand that in some areas, like more towards the west or more towards the coast, you may get less participating providers, but if you need help finding one, we can show you how to use the online tool to look up a provider. There's also access to international dentists in more than 200 countries through the MetLife's International Dental Travel Assistance Program, which I'll talk more about. And you can go to any dentist in and out of network, usually when it's for more routine things like cleanings, x-rays, you're not going to see a difference. But when it comes to bigger stuff like crowns or teeth extraction, wisdom teeth removal, bridges, stuff like that, you're going to see a bigger difference in cost going in versus out of network. So currently our dental plan is administered by MetLife. It will be the same in 2026. We have a low, classic, and high option available. I'm going to go over the difference in the three options. This dental plan does provide ID cards. They are mailed with a unique ID. Now, if you go during open enrollment and you don't change plans and you haven't changed employers, MetLife doesn't send a new card every year, but you can print a card from your metlife.com/mybenefits portal. And there's also a generic card on our website that you can print, which I'll see if I can pull up for you. And the generic card, really going to the dentist with a card isn't necessary unless the dentist doesn't have your social security number on file and you don't want to provide that, then that's when you would need that unique ID. But otherwise, you can just go to the dentist, tell them you have MetLife Dental with the state of North Carolina, and they should be able to look you up. This, I'm going to put in the generic card in the chat. So if you need just a card to have to show that you have MetLife Dental through us, you can click on that and print it off. There was something else I was going to say about the ID cards, but now I'm trying to remember. Oh, I know what I was going to tell you. I mentioned that during open enrollment, and during open enrollment in October, you can make changes to this plan if you want to go from classic to low or classic to high or any which way. If you want to add dependents, remove dependents. So I was going to just mention open enrollment dates this year, and that's for NCFlex and the State Health Plan. So open enrollment is going to be October 13th through the 31st. And I'm putting that in the chat for you. So if you have a calendar and you want to mark that down just so you don't forget, that's the time that you can make changes to your plan outside of a life event. Then you just mark that down on your calendar so you know when you can make changes. Maybe you have some stuff coming up that you need done and you want to have better coverage, or you had a bunch of stuff done this year and now you need lower coverage. So that login to metlife.com/benefits, that is where you can print cards, you can view your claim status, or you can find a participating dentist. When you first go to metlife.com/mybenefits, it's going to ask you for a company name, and that's where you enter NCFlex. There is a single sign-on option. I'm going to show you what that looks like in a second. Through your benefits portal, eBenefits has it now, as well as Empyrean. So if you are a university employee, it's going to be an Empyrean. For non-university, it's going to be an e-benefits. You can go to any licensed dentist for care, but you save money by going to an in-network provider, as we've mentioned before. So here I noted that when you go into your benefits portal, either eBenefits or Empyrean, you'll find a single sign-on link. There are links. That first, where the blue circle is, that top item, is what it looks like on eBenefits. The bottom one is what it looks like on Empyrean. Both of these are on the very first page you come to when you log into your enrollment platform. And if you click on those links, whichever platform you're in, and you do have the dental plan, it's going to automatically take you to your dental account. So you don't have to log in through the metlife.com/mybenefits, which you can still do that too. But sometimes I find this easier. It's helpful. Like, let's say that you go to the dentist and you have a large amount to pay and you use your FSA card. Well, with our flexible spending account card, sometimes we get asked for documentation to justify the money that we use the card for. They want to see what if the insurance paid for anything. And what you would do in that scenario is you could go to under quick links, you could click on your P&A spending accounts link, see what kind of see if they're requesting documentation. Then you could go to your MetLife dental link, pull up an explanation of benefits under claims and provide that to P&A. You can upload it directly to their site. So having the quick links here to all of the accounts is kind of nice when you have to do something like that. Or during open enrollment, when you're wanting to see things like how much money you have left in your FSA account, or how much of the maximum with the dental plan did you use this year? Are you going to need more of a maximum next year? So there's quick links here to Allstate, iMed for vision, P&A for FSA, and MetLife. And there's also one under eBenefits for the Aetna portal for your medical. So going into plan comparisons, you'll see the three options: high in the purple, classic in the green, and low in the aqua color there. There's another slide or two on the comparison. But the first thing you'll notice is the deductible. And the deductible is the amount you have to pay before certain benefits are covered. For both the high and the classic, those deductibles don't apply until you get to, I'm going to skip to this slide real quick, until you get to these basic services like fillings, periodontal services, oral surgery, extractions. The deductible doesn't apply to, like, if you're getting a cleaning or x-rays for the high and the classic. Only on the low does it apply. So like when I go for my cleaning each year, I have the low plan, I pay $25. Then my kids go, I pay $25 for each of them on those cleanings. But on the classic and the high, you don't pay that deductible on those cleanings. And then the next line is the maximum. So the annual maximum is how much MetLife is going to pay out per year. This does include cleanings and x-rays. So if you're looking at the low option and this year you have 2 cleanings and MetLife pays $200 per cleaning, then you have x-rays. Let's say MetLife pays $300 of that. Right there, you've already hit $700 of your maximum. And if that's all you need, if all you need is maintenance, then that works for you. For the classic option, because it covers higher things, again, skipping to this slide, the classic has some coverage on crowns, whereas low doesn't. So on classic, when you're thinking about this $1,500 maximum per year, and you think about 2 cleanings, if you did have x-rays, and if you had a crown, you're going to hit that $1,500 pretty quickly. So the classic is good for like average maintenance. Maybe I'll need a crown, maybe I'll need some fillings. I'm going to have this just in case. But once they pay that $1,500, they will pay no more. So even if you've only had one cleaning and a crown and maybe some other things done, and you technically get a second cleaning in the year, if MetLife has hit that 1,500, your cleaning is not covered. So if you do think you're going to have more extensive work done, that's when you'll consider the high option, because the out of pocket, or the, sorry, not out of pocket, the annual maximum MetLife will cover is $5,000. Which is much higher. We don't have a lot of people who hit that max, but there are people who could get up to that amount, especially if you're going to have some major work done, catch up on some things, some extractions, wisdom teeth removal, then you may need that 5,000. Then the next line item is the orthodontic maximum, and this is a lifetime max per covered person. Now, our orthodontia coverage only applies to children under age 19. It does not apply to adults. So this would not be something that you could use as an employee, but you could use for your children. And the lifetime maximum is $1,500. And that's only on high and classic. So that's another reason to consider the higher the classic option, is if you do want orthodontia coverage for children. And it is outside of the other maximum above it. So it's its own max. It doesn't go towards the annual maximum. It's its own max. And so on this slide, where you look at the orthodontia at the bottom under high and classic, where they're covering 50% under age 19, then you would consider, okay, if my child is going to have the orthodontia plan cost $3,200. Once MetLife hits that 1,500, it's going to stop. That's for lifetime, because it's going to pay 50% up to 1,500. You know, orthodontia typically with braces or with Invisalign is going to cost more than 1,500, but that's a great time or great way to put your FSA money to use, is putting the FSA money away and using it for orthodontia treatment, because now you're paying for it pre-tax. And with orthodontia treatment, typically they're going to give you a treatment plan up front, which you pay like a deposit for, and then they'll have monthly installments, which you can use an FSA for. On this slide, all three plans are going to give you 2 cleanings a year. Again, if you haven't hit that max, they're going to give x-rays. I think it's once every 5 years for full mouth x-rays. And I can't remember the bite wings, but the bite wings is more frequent. And in our guide online on our NCFlex.org, it does go over all of the details of how often things can be covered. And also in our certificate, which is on our website as well, it goes into even further detail.
Hey, Tara.
Yeah.
It's Mary. I was going to chime in. You're just right. The bite wings are, I believe they're once per calendar year.
That's right.
And then the full set is once every 5 years.
Thank you, Mary. Yep. I just pulled out my guide and I was trying to find that. I thought it was once a year, but for some reason I wanted to say 2 years and I didn't think that was right. And then you'll notice with the basic fillings, simple extractions, you got a little more coverage under high. Classic goes to 60% and low is at 50%. And when you get into things like crowns, dentures, bridges, implants, high and classic cover 50% after deductible up to that maximum, and then low doesn't cover that, and low doesn't have the orthodontia. So again, you may want to look at your MetLife portal before open enrollment, during open enrollment, see what you did this year. Talk to your dentist about if there's anything they suspect coming up that you may want to switch plans for. These are the current dental rates for 2025. And these, again, come out of your check pre-tax. And I'm going to kind of show you what that means. So when you are comparing one plan to another, if you are considering another dental plan, you would want to think about these coming out of your check pre-tax, whereas other plans may come out post-tax. Yeah, so anonymous, you said, are all of these percentages only applied to what the insurer considers reasonable and customary charges? So if a dentist charges more, we are responsible for the difference. That is if you're going out of network, and we have an example on that. But if you're going in network, the dentist is limited on what they can charge you. And you truly would then only be responsible, let's say, for 50%, for a crown. And if you're going out of network, that's when you may have to make up the difference. Yes, because MetLife is paying on the reasonable and customary charges. That's right. And I'll show you an example of that. But on these rates, when you skip to this slide, this shows you, I thought I had, no, I didn't do a circle. This shows you with an example of 25% pre-tax savings. It depends on your tax bracket, but we went on the low end, 25% tax savings. It could be higher. If you have the dental classic employee only coverage at $36.70 a month, you're really only paying about $27.53. That saves you $9.17 a month, and you're saving about $110 a year in taxes. Skipping down to the very bottom one, if you have the low plan with employee children, you're paying $53.40 a month, which is more like $40.05 a month. When you look at your pay stub, it's going to say $53.40, but if you remove that line item, it would only increase your check by about $40 because it's coming out pre-tax and you're not taxed on that premium amount. So you would save about $13 a month on tax savings, and then $160 a year. And then on that middle one, that high employee plus family, it looks like a lot when you're looking at $200.12 a month, but in reality, it's more like $150 a month because it's a pre-tax savings. So again, when you're comparing plans to maybe employer-sponsored plans, or Scenic has a plan they offer out there, just consider the pre-tax savings on this one. So there is a dental cost estimator where you can look at the difference on average of cost between in-network and out-of-network dentists. When you go to your MetLife dental account and you log in, you can choose My Accounts, click I want to, and there's a get a cost estimate option. Then you can choose the type of procedure, or if you have a code from your dentist, that can help find it quicker. And you can click between in versus out of network to see what the difference is. So this gives an example of what someone just asked about. So network savings example, if you do go in network versus out of network, let's say for a crown. So on the left-hand side, if Katie goes in network and the dentist's usual charge is $14.62, and MetLife has negotiated a cost with them of $680, MetLife is going to pay 50% of that negotiated cost, and you're going to be responsible for the other 50% of the negotiated cost, and that's it. Whereas if you do go out of network for a crown, which you can do, and I understand sometimes people have a preference, and that's fine, just know that you will pay a little bit more. So in that scenario, when they go out of network and there is the dentist's usual charge of $14.62, the RNC on the left-hand side stands for reasonable and customary. That's what MetLife believes the dentist should charge, which is $14.51. MetLife will pay 50% of that reasonable and customary, and then you'll owe the other 50% plus any additional charges the dentist charged you. Okay. Now, to find a dental provider, you would go to the metlife.com/mybenefits. You don't even have to log in to look for a dental provider. You can just enter NCFlex as the company name. You click next, and then you should see where you enter the zip code here and then find a dentist. And you can even narrow it down by specialty, I believe, if you're looking for a certain type of dentist.
Yep, that's exactly right, Kara. And one thing else I want to point out on that, just to everybody that's on the call, a lot of people don't realize you can actually narrow that search to within like a 5 mile radius, I believe is as low as we'll go. So if you are looking, especially if you're in an area that's not a city, right, not a big city, you're in a more rural area of the state, if you will narrow that search to 5 or 10 mile radius, you should get more hits in your town, instead of getting, because we have what's called the spotlight dentist. So the search feature will come and give you like our highest rated spotlights. But if you've got your search parameters set to a 30 mile radius, you might get hits that aren't in your town. So if you drill that down by your radius to like a 5-10 mile search, you usually get a lot more hits in your area.
So this is the website, and that's where you put in, we're here, it asks for the organization, and you click next. And let's see. And you can scroll down, and this is where you can log in and do a find a dentist that way, but you can scroll down here and put in a zip code. And like she said, you can narrow down the search so you don't have as large of a, because here I just put in a zip code that's near Raleigh, which is probably going to give a huge amount, 8,144 dentists within a 25 miles of your zip code. So like she said, you can narrow it down to 5 miles.
And then sort by your specialty. If you're looking
Uh-huh.
for like a a pediatric dentistry, or maybe an endodontist, you can look that way. So just something to keep in mind.
Thank you. Yeah. And you could also ask your dentist, like, if you already go to the dentist or have someone in mind that you want to try out, you can always call them and ask them as well. But if you want to look for someone new, you can go here. All right. Let's see if I can reshare my slides. Okay, so I talked a little bit about the healthcare FSA and out-of-pocket expenses and how you can use that to pay for things not paid for by the dental plan. Just remember that anything paid for by MetLife or any other, like if you have the medical plan or the vision plan, anything paid for by the insurance should not be also spent on the FSA account. But anything you have to pay out of pocket, you can use the FSA for, a healthcare flexible spending account. And you can re-elect this account every open enrollment. Again, this open enrollment is October 13th through October 31st this year for 2026. The annual limit of next year is $3,300 per person who can participate. So if both you and your spouse are eligible to participate, you can both put in that full amount. You should not put into the healthcare FSA if your spouse contributes to a health savings account, HSA. That's a different type of account. If they participate in that and contribute to that, you should not contribute to this. Otherwise, this is a great plan. You're just taking your own money, setting it aside pre-tax, and using it for things that you may need to pay for out of pocket: dental, vision, and medical. It's loaded onto a card. It's all available January 1st if you enroll during open enrollment, even though you haven't had any deductions. And you can use, like I mentioned before, your explanation of benefits from MetLife's My Benefits portal to file a claim or substantiate a claim if needed. So if I go and have a crown done and I swipe my card for $400 at the dentist, most likely PNA is going to ask me for documentation, and that's when I would use that explanation of benefits from MetLife to show what they paid and what I had to pay. If you are planning on major work next year, try to get a pre-estimate from MetLife first to see what they'll pay for any work you might be having done in 2026, and that could help you plan for how much to put in the FSA for 2026. So a little bit about MetLife travel assistance. And we have with our dental and our vision plans and all of our plans, like we have accident and cancer and critical illness, those are more supplemental medical where they pay you money for certain things happening, whereas the dental and vision are paying for services at a provider for dental and vision. You can use our MetLife Dental all across the United States in the same way you would use in North Carolina. But the travel assistance comes into play if you are going international outside of the US. It gives you access to providers in more than 200 countries. The providers are selected based on strict credentialing criteria. MetLife does not require pre-authorization for non-emergency services occurring outside of the US, but they do recommend it just in case something's not covered. You may want to get a pre-approval. Coverage will be considered under your out-of-network benefits, but again, there'll still be some coverage for the providers. Retain all receipts to submit a claim. And MetLife does not maintain an online provider file for dentists located out of the US. But if you are in the US and planning an international trip, you can call this 888 number, 558-2704, and they can help you locate a participating dentist in case you need that while you're out of the country. And then, of course, if you're traveling within the United States, you would just use the regular Find a Dentist tool that we just showed you. There is a flyer available on our website in the dental section, which after I'm done with these slides, I'll go to and paste that for you if you'd like it. MetLife does have a mobile app where you can find a dentist, get estimates for most procedures. It has a personalized display, plan-specific cost, and additional information like percent covered, applicable deductible, plan maximum, and frequency limits. Usually when you go to the dentist, they're also going to be able to pull that information up, but if you want to have it on hand just in case, you can also do that. You can view your plan summary with deductibles, maximums, covered services, and frequency limits. You can look at your claims on the mobile app, track your brushing and flossing, which you might like or your children might like. Access and save your ID card to the photo library or mobile app. So that way, if you lose your card, you don't have to go finding it. It's on there. You can search MetLife in iTunes App Store or Google Play to download it. And once you register at metlife.com/mybenefits from a computer or directly through the app, then you can use the app. Oops, just went by. So some resources for you if you have more questions about the dental plan or other NCFlex plans, you can go to ncflex.org. We've got details on each of our plans. We have certificates on everything if you want to really get down into the weeds with what's covered and what's not. Claim forms, FAQs, videos, our enrollment guide, which goes over all of our plans. We have an email address, ncflex@nc.gov. And then that's MetLife's information there. Okay, so someone asked, if I retire in December, what do I do during enrollment in reference to dental accident critical illness plans? Do I elect not to be covered for 2026, or what is the correct procedure? That's a good question. So I'm going to go to our website to show you a couple resources real quick. Let me share the screen with you. So I'm gonna log out. I think I was on here editing. Just need to log out of there. So we did a whole webinar last month, which you can find on our webinars page about this topic. What happens when you leave due to retirement or just leave employment? And you can find the slides and the recording here if you really want to go into more detail about it, which I'm going to tell you a little bit now, but in case you want to go into more detail, this is the webinars page. I'm going to post in the chat. But we have this resource that we talk about in that webinar. And this is like a brochure, and it goes over everything about all of our benefits and what happens to them when you leave. So it notes that dental and vision would continue through COBRA if you want to continue them. And COBRA is just a limited period of continuation. Your question was if you're retiring, I think you said in December, so you're retiring January 1st, you don't technically need to re-enroll or disenroll from anything for 2026. Anything you had when you leave, you're going to be offered continuation for if it applies. So if you have the accident plan before you leave and you're under age 70, I think it's age 70, Voya will send you portability information. If you had the critical illness before you leave, Voya will send you continuation information because those two plans are portable. Same with cancer. All these vendors, when it does say that it's portable or there's COBRA or continuation, they are supposed to send you information on how to do that. But the phone numbers are on here too on this document, which I'll also put in the chat. The phone numbers are on the second page, page 2, for all the vendors. So if you don't get something in the mail, or really when you retire, I hear that you get a ton of stuff, so it's kind of overwhelming, and you may think, I really wanted to continue that critical illness plan, but I have no idea where the paperwork is. Well, you can call Voya and just say, I need a copy, or how do I continue this? With dental and vision, with the COBRA, you can go up to 18 months when you retire or leave employment for any reason other than gross misconduct. And then after that 18 months is over, or if you just don't want to do COBRA, you can go with another option. And we actually talk about that. I think it's on the very last page of this brochure. What happens after COBRA ends? This is also, if you don't want to do COBRA, then you can look at a few things we noted here, like ncretiree.com is Pierce. They contract with the retirement system. You can look at Scenic's website, and you can look at NCRGEA, North Carolina Retired Government Employees Association. And you would want to look at the dental plans, who their insurance carriers are. Does your dentist take that insurance carrier? I think Pierce is their dentist through United Healthcare, I believe. NCRGEA, I want to say theirs is through Delta Dental, but I'm not 100% sure. So you could look at what theirs are, decide if you want those after you retire or if you want to continue the COBRA. The nice thing about COBRA is that the rates are usually about the same as you're paying now as an employee. The classic option is the only one that we subsidize, meaning we pay a small portion of that while you're an employee. So that rate would go up slightly if you have classic. All the other ones would stay the same. You'd pay. And also, when you leave employment, you have up to 60 days to elect COBRA. And when you elect it, even if, like, let's say you retire January 1st and you get the documentation and you don't choose your COBRA plan until January 26th, it's going to retro back to January 1st so that you never had a gap in coverage. With some of these other plans, if you did go with them, even Pierce will tell you they're going to have a gap in coverage. So they'll usually recommend to at least do COBRA for a month or two before you go onto their plans. So that's a little bit of information about what happens to dental when you leave employment, and then use these resources. Check out that webinar. If all else fails, just email us, ncflex@nc.gov, and we can remind you. We can even look at the plans that you have and just say, these are the options. They're going to send you information. Let's see. We'll stay on for a few more minutes if you have any other questions. I was also going to show you, find that international travel flyer under the dental plan, which it's right here, International Dental Travel Assistance. So I'll put that in the chat if you'd like that. And we do have a whole page. We have the brochure about continuation after you leave. And then we also have a web page on here, which actually gives you the cost of the dental and vision plans currently for Cobra. So you can see them there if you're curious how much it would cost when you leave. Now, when you do pay the Cobra premiums, they're not pre-tax, so you're not getting the pre-tax savings. But at least for the most part, you'd either pay what you were paying before you left, or for the Classic, you'd pay slightly more. Mary, was there anything you wanted to add?
I think you did a great job, Kara. Covered it nicely.
Okay, cool. Well, it doesn't look like we have any other questions, so we can sign off. But if you guys think of anything afterwards or have something, specific to you that you want to ask us about outside of here, email us, ncflex@nc.gov. You can even call. I think our main number is 984-236-0800, and you can ask for someone on the NCFlex team, and we can just talk over the phone. So thanks for joining today. I hope you guys have a great Tuesday afternoon. Thank you, Mary, for joining.
Thanks, Kara. Nice job.
All right. Bye, y'all.
Bye.